Thanks, Venkatesh. Thanks, Raghunandan. Thanks, Jamuna ma'am, Abul Qasim sir, and Dr. Hariharan sir. Thanks for this opportunity. I start this slideshow without putting my name or anything, simply because many of you were telling something more about me and better about me and good about me. Seems like, okay, I don't want to blow my own trumpet then. So that's the reason why I want to start the topic with just a topic saying the scope of orthopedics as a career option. So let me start here. So before talking about the topic, I want to dissect the topic, right? As a medicine person, we always love to dissect. So the topic given to me, scope. What do you mean by scope? You know, the Oxford Dictionary says the word scope means the extent of the area or the subject matter that something deals with or to which it is relevant. So so the word scopes deals with opportunity, the impact, the management, the risk, the process, the identification, and what are all the strategies, research and resources, and several other things, the risk involved and every other things in orthopedics. So I think this topic is quite important for students who are planning and preparing to choose orthopedics as their specialty. So scope of orthopedics, if you ask me, is the scope of orthopedics increasing or decreasing? Are people now favoring orthopedics or abandoning orthopedics? And if you ask me in one word, I'm telling the scope of orthopedics is always increasing. Never in the history it has gone down any time. And the scope is always increasing because you simply analyze the word orthopedics. The word ortho means straight and the word pedics means children. So the word orthopedics means to straighten the crippled children. That's it. So initially, this field was invented or innovated in order to treat the crippled child. Are we now restricting our scope to just manage the crippled kids? No. Crippled adults? No. Crippled elderly? No. People with just bone tumors? No. With infection? No. We are now involving everything. We deal with trauma, we deal with infection, we deal with tumor, we deal with pediatric deformities, we deal with TBs, we deal with geriatric medicine, regenerative medicine. We are evolving and we are continuously innovating. So even the word orthopedics, despite the word hasn't evolved much, the field has evolved a lot. And now the specialty of orthopedics is not just trauma as what we think most of the time, but now there are heaps of subspecialties coming into this picture, and spine surgery, large joint surgeries like knee joint, hip joint, and people are subspecializing in these large joints, and people want to subspecialize in sports surgeries like arthroscopic and minimally invasive procedures, soft tissue repairs, and people want to deal only with extremities like hands and foot. And trauma surgery, of course, is a part of orthopedic surgeries and orthobiologicals. So many people once consider ortho as a subject of more mechanical nature, that you don't need much of a knowledge of biology in it. But there is a new specialty called orthobiologics, and which is many people are predicting it will rule the department very soon as well. So the horizon of orthopedics has increased to a greater extent. So the scope is always increasing. So without any doubt, it increases. And coming on to the subspecialties available in orthopedics, many people now. So if you ask me, I'm subspecializing in sports surgery and preferably in knees and shoulders. And of course, I'm pretty happy to operate on elbows and hand, but I'm the concept of general orthopedician, that I'm going to treat any bone problem from top to bottom, is getting slowly outdated, and I think that is a way to go as well. So if you are thinking to be an orthopedician, try to read, the anatomy well when you are doing your medicine, and which joint impresses you more. For me, shoulder impresses me more, simply because it evolved so different, and it is a joint with maximum mobility, and it makes human a human. And no other animal in the whole world or in the universe is having the ability of a human shoulder, and it differentiates us from even our closest relative in the evolution, which is chimpanzee. So somehow shoulder was impressing my thoughts several times, and that's why I wanted to be a shoulder surgeon. So something like that. So try to develop a passion for some subspecialty in orthopedics and slowly go towards it. You can be a jack of all trade, but remember, instead of doing an average job at everything, you can do the best job at few things and call yourself expert. That is a way to go, in my opinion. And so will the scope of orthopedics further increase? As long as there is a creativity, as long as there is an innovation exist in this department, I think the scope of orthopedics will always increase. So what about creativity and innovation? And it is not only true for orthopedics, for that matter, it holds true for any other department. So hope you all guys agree with it. So is there any creativity? Is there any innovation happening in the department of orthopedics? I would say yes. Come on, guys. We started operating with the robots much ahead of many other departments. Robotic system and navigation system are in orthopedics for close to 20 years now, and we are producing great results with the help of robotics and navigation. To be honest, orthopedics is one of the department or one of the earliest department to embrace other culture, for example, engineering, technology, nanotechnology, and other things. And we started evolving along with other discipline of science like physics, chemistry, and other things, right? So robotics is one such classical example. And look at that guy, and that's me in Melbourne. So this is a mixed reality and virtual reality. And ever since the virtual reality come into the picture, I think orthopedic specialty is the first specialty to embrace the mixed reality, in which in this video, can you see, I'm taking, I do a 3D modeling of a scapula of a patient and then put the scapula in the operating table. Thereby, I can practice my own surgery even before starting operating on the patient. And when I want to do the surgery onto the patient, I will position the same scapula, what I had designed, into the actual scapula of the patient after exposure. And then I'll take my cuts, I will take my guide pin entry, and I will put my trajectory as according to my plan. So, in order to give the best and efficient care, we are the one who started accepting the creativity of other discipline of science. So I think the scope is increasing. I hope you guys won't disagree with my statement. And the PSI, and just for the sake of this seminar, I got a few models from my surgery, what I did last week. So can you all see this? So this is basically a 3D printed femur. Okay, so previously we have like a big tray set comes to you, and the tray set is like a fixed tray set for every total knee replacement, and you have only some linear adjustment which you can make, like whether you want a 2-degree valgus or 3-degree valgus or varus, and how you want to correct the angular deformity, how you want to correct the sagittal deformity, and things like that, right? So it's like a fixed instrumentation. But now what we do here is we print the actual femur of the patient, right? And we plan how we are going to do the surgery, and we do the surgery virtually. And we will ask the computer, the computer-aided designing, to run the range of movement assessment and to tell. So if I make the cut in femur this way, can you see small lines in this femur, what I have marked? So if I cut the femur at this level and put the implant as according to the plan, how would be the range of movement post-operatively? So I can predict the range of movement using the artificial intelligence and data computations. And, so once I'm happy with my cut, then I will design a jig to make the cut, accurate. And for example, I made this jig for that patient, and which exactly fits into femur like that. So this is what called as PSI, a patient-specific instrumentation. Can you see? So once I designed this jig, then during the procedure, I will take this jig and put it in the right on the patient's femur, and then I will take a cut. So now I don't need to rely on a fixed instrumentation. Rather, I will make my own instrumentation to take the femur cut in case of a total knee replacement. And this is my tibia, and that's the tibial cut, what I was planning, right? So this is what called as a patient-specific instrumentation. So you can practice your surgery in a 3D model, and you can plan the range of movement. You can, you can well ahead analyze how much would be the range of movement in the patient when they undergo the surgery. And based on that, you can modify the instrumentation right ahead of time and then give the best outcome to the patient. Is it not innovation and creativity to a greater extent in the field of orthopedics, especially in the last 5 to 10 years? I should say orthopedics is growing the growth rate, that the projectile is too steep, and it is embracing a lot of other technology, and the creativity is phenomenal. And look into this patient, like, can you see here, there is a tumor in the pelvis, and they want to, they printed the 3D pelvis in it, and then they create a 3D printed implant, which is biocompatible, and then replace the whole part which was affected with the tumor. Think about, like 30 years or 40 years back, if the same patient with the same tumor, and if it tend to have some aggressive potential, these people would end up in having a big amputation involving the pelvis. But now you are saving now the surgery has become more of a limb salvage. And looking to the other tumor here, and this tumor is affecting the metaphysis, but the epiphysis is spared. And when I'm sure that it doesn't have any satellite lesion, and I can use the computer-aided designing and can prepare my own custom implant for this patient, all it's sitting in the system, right in front of the system, and ask their company guys to just create what I have planned. And by this, I haven't even lost the joint. Leave amputation. Amputation is so outdated now, and now we are not even we are trying to spare even the joint affected and make sure the patient is having good range of movement as well, right? So that's about the innovation in orthopedics. And CT navigation feedback, and when you are putting a screw in a spinal cord, especially through the pedicle process, you don't want to damage any precious and important structure nearby. So the CT guided navigation feedback would tell you, oh, come on, doctor, you need to increase your projectile. Your trajectory is right or wrong, or your entry point is right or wrong. These navigation and the feedback mechanisms were not there like 20 years back, but now we have innovated. So there are heaps of scope, and there are numerous examples available for us to say the scope of orthopedics is ever increasing. And orthobiologicals, last but not the least, now people, no one wants surgery if they can avoid. Everyone wants to avoid surgery, right? It takes a lot of pressure for the patient to decide to put themselves under your knife, to go asleep without conscious under the gases of anesthetics, right? So it is a big decision sometimes. So if you can do something to avoid a surgery, obviously we will try our level best, right? And so one specialty which is coming up highly these days is the PRP therapy and other orthobiologics to help with the healing process, especially with the degenerative changes. But remember, be sensible, okay? A lot of orthopedic problem, including the arthritis and several other problems of orthopedics, is more of mechanical problem. When you are having a mechanical problem, treat the mechanical problem in a mechanical way, right? But when the problem is chemical, you want to treat it in a chemical way. When the problem is the biological, you want to treat it in a biological way. So in that way, orthobiology has become a pillar of treatment management when it comes to orthopedic practice. But I won't say that it is going to replace the whole of orthopedics now, right? That's why I'm telling every single subspecialty and every single innovation in orthopedics has its own potential to stand alone and withstand the time crisis and to win over, right? So I feel orthobiologics is of great potential and value to manage a lot of degenerative problems, but may not be of great help when it comes to deformity. I think still surgery holds the key. And think about 3D cellular printing. When there is a rotator cuff, the biology is now, was completely buggered, and trashed. And in that case, all you need, even if you're trying to do the surgery, when the biology is not intact, when the tissue is has already been aged, I don't think the rotator cuff is going to heal, or the ligaments or the tendon, when they are having a precarious blood flow, I don't think they will heal well simply with the surgery. In that case, think like if the current innovation system can help us making an artificial rotator cuff with the help of 3D cellular printing, and add some tenocytes into these printed models, and then these tenocytes started growing some tendon and things like that, that would be great, right? So that is about the 3D cellular printing and things, so which is coming up highly. So this is actually from an journal article published. So authors and scientists are now preparing the printing modules on which you can add the biology. So thereby you will have the conductive principle and the inductive and the genetic potential in a patch of an artificial synthetic thing. So that's phenomenal. AI. Now, in several countries, after a patient getting a total knee replacement and things like that, the patient was given an Apple Watch or something like that to monitor the range of movement, the number of steps. So by embracing the data from the patient, this helps us to diagnose the condition, helps us manage the condition, give them the best rehab potential. And also these data can form like a collective pool, thereby we can do a quality research and do a great systematic analysis. So the data and artificial intelligence in the orthopedics is growing and evolving. I think it's going to rule orthopedics very soon. So research, even after doing an orthopedics, if you're not interested in clinics, I would still say the research are happening everywhere in orthopedics, right? The sports are evolving. Several countries now has come to a level are not remaining anymore as a third world country. Every country wants to develop their sports, and with the development of sports, the sports related pathology and the sports related injury evolves, and people would expect you to think about the body biomechanics before you just going and do just cutting and stitching and calling yourself a surgeon. They want to know more mechanics, more physics, and more functional outcomes. So they would expect all these things. So people with an orthopedic background, if they put themselves in the research and academics, they can still be of great value and can create a great impact in the field of orthopedics as well. So orthopedics is not just the theater. Orthopedics is not just the clinic. Orthopedics is the field has evolved so much that you can remain as an orthopedic a person despite just sticking yourself to academics or to research or to clinics alone or to mere surgery. So the choice is yours now because the specialty is very broad now. But come on, doctor, you are telling this field is evolving, the field is innovating, but do you really need the patient-specific instrumentation? Do you really need navigation? Do you really need all these technology? Or is it all you're trying to sell a magic dose or a magic key and trying to sell the magic key as a key to every single thing or every single pathology in orthopedics? Or like, are you just trying to market the innovation, or is it true? Then there comes the question, with all this technology, if there is no orthopedic injury happening in this world, if there is no sports injury happening in this world, if there is no spine injury happening in this world, if there is no degeneration happening in this world, then all this innovation and invention would go irrelevant. So you need to be relevant, right? So what is the disease burden? So the science is evolving, but what about the disease burden? Do we have a real burden of degenerative disease and spine problems and other things in the field in this world? Look into this paper. See, like if you are going and sitting in any orthopedic OPD, the predominant number of patients are presenting to you with a lower back pain, tendinopathy, arthritis, soft tissue injuries. Many people would say orthopedician is just going to operate on a fracture and to treat their deformities. No, the most common complaint to an orthopedic OPD is not a fracture, it's a lower back pain, tendinopathies, arthritis, and soft tissue injuries. I'm telling, there are heaps of policies in countries like India and also in the developed countries where I'm working. like to control the road traffic accidents, the land accidents and things like that. But what is the policy in place to prevent a lower back pain? Is there any policy in this world available to prevent aging, to prevent degeneration, to prevent arthritis? Rather, the population is getting gray in the developed countries, and also in southern part of India, the population is getting gray. So the number of people who are going to be affected with arthritis and degenerative disease is more. And you can't tell a 70-year-old lady, come on, you are aged, just sit at home, you can't do anything. Like you ripping their abilities and function of their ability to move, or their mobility is like you ripping their freedom, right? Just because they are old, we can't rip their freedom. So every arthritic patient may need some kind of an orthopedic assessment and management to come out and function as normal as they were 20 years back, right? So if we can do that by surgery or orthobiologics, then we would still be relevant. And that's what I'm talking about. The science is evolving, and at the same time, the burden is increasing as well. And no wonder the science would evolve with the burden. You know, it's always a demand supply thing. And trauma is much less. Where is trauma here? After like heaps of other complaints, trauma comes here, right? So I would say the degenerative medicine is the component in orthopedics is evolving much more, and the tip of the iceberg. It's what you think about orthopedics is just the tip of the iceberg, and you have a lot more other stuff buried underneath. So explore the field. It is a good specialty to subspecialize in. And look into the spine injury. So the land transport, like look at South Asia, the falls are increasing, but in 10 years or 20 years, we would be a developed countries, right? And in that case, then the land transport related problems would increase, the sports related injuries. Now in India, you can see only like 1% of spine injuries are from sports, but countries like Australia, countries like America is having close to like 10% of spine injuries from sports and recreational activity, and India is not going to be far away from similar kind of scenario in future. So sports injuries are in rise, and it is a good subspecialty to work on. And think of degenerative disease and look into the annual incidence, guys. See, India is looking green in this, but I'm telling that is because of under-reporting of the disease and the degenerative changes. And, you know, whenever there is a degenerative changes in a 60 or 70-year-old lady with a spine problem, we would say, take rest. Come on, you don't need a spine surgery. So we don't report the incidence, and that's why we are looking green. This doesn't mean we are truly green. Okay, and also the average number of years an Indian surviving is much less than an American and an Australian and people of a first world country. So the possibility of them developing the degeneration itself is less because of their lower life expectancy. And this is another chart showing that, you know, how because of the spine injury, a person's activity of daily living and their productive living is affected. And, you know, like sorry for the bad terminology. So this says a bone cancer treatment market. I would say a bone cancer treatment burden, right? So that is a right word. If you see India, even America and India, both are having a bone cancer, the prevalence is very high, and the availability of surgery to such patient with bone cancer is very less, right? So the number of orthopedic bone tumor surgeons in the country is very, very less than what you are thinking. So the cancer treatment is not neither. It's very expensive, number one. And when you can bring this expense of the cancer treatment of bone down, only when you get more doctors on the specialty and more research happening here, thereby we can get a more affordable kind of treatment. Thereby more people would have access to these kind of surgeries. And look into the share of population without access to surgery. India is in like a dark, right? Close more than 80% of the population who may actually need a surgery or not getting the surgery done, right? Why? Because we assume surgery is not needed, especially when there is a physical problem happening, mechanical problem running in the patient, like deformities and degeneration and arthritis and things happening, and you just assume, it is what it is, you just accept. Okay, I agree, acceptance is good, but not at the cost of your freedom and your mobility, I would say. Look into countries like US and the Scandinavian countries, all these Europe and several part of Europe, the access to surgery is close to 100%. It's close to 100%, right? But in our country, the access to surgery is very, very limited. So now we discussed about the key words in my topic was three, in my opinion. Number one, scope. Number two, orthopedics. So I hope I discussed about the scope and orthopedics. But the third word, as a career option. So that's another important keyword. So what is career? So when I refer to Oxford, it says career is an occupation. I'm telling you, career is an occupation. Career is a job. It is not life. Okay. Career is an occupation undertaken for significant period of person's life. Okay. With an opportunity for progress. So if you are not finding a progress, if you are not finding opportunities there, if you are finding a job which is not worth enough to give significant period of your life, then that opportunity or job cannot be considered as a career. So in order to call something as a career, it should be a job which deserve a significant period of your life and the commitment and the passion, and it should give you an opportunity for progress, right? Thus, orthopedic has this. So in order to spend significant period of your life in a field or a specialty, it needs to be routine. It should be routine, which means you should have a predictable outcome. If you are doing a total knee replacement, you will get this kind of outcome. If you are getting done with a total shoulder replacement, you will have this kind of outcome. If you are getting done with a rotator cuff, so it should have a predictable outcome, but the path towards the outcome must be adventurous, that every single total replacement is different and every single rotator cuff surgery is different. Every single sports surgery is different. So it must be a non-boring, it should be adventurous, and it should give you a new learning every day. And there has to be heaps of challenges and variation. And unlike medicine, I think surgery is much, much more complex, and it throws new challenges every time you put your knife on the skin of the patient. And you think that you are predictable and you will predict the outcome, but it is very, very hard, and it requires a lot of commitment and perseverance to excel in the field of orthopedics. So every injury involves a very different mechanism. No two fracture would mimic exactly the same. I'm telling you, no two fracture would mimic exactly the same. There will be some kind of difference in everything, and no two people would operate on the same fracture the same way. So it is a specialty of diversity, I would say. In that case, that is what I think. Orthopedics, it is very hard for a robo or for an artificial intelligence to completely replace a surgeon. It can replace an IT technician, it can replace a lawyer, it can replace anyone, but to replace a surgeon, it is very hard. And I'm telling you guys, it is wise to stick to a specialty which is very hard to replace. So remember, same as how you are absolutely unique, every single fracture is unique, every single disease is unique, every single patient is unique, right? So remember that. So that's going to be your challenge, and that's going to be your challenge, and that fuels or pumps the thrill into the specialty. And so orthopedics, is it all rosy as I'm telling? No way. If you go, this is a paper published among all highly successful orthopedic surgeons, and they asked them number of hours they work per week. In countries like America, no physician would work more than 40 hours or 45 hours per week, right? But if you ask an orthopedician, they are working nearly close to 2 times, which means like 70 hours. Okay, and they are very clear about how, and they are not restricting themselves only to the clinics and surgery. They are telling 40% of my time is clinic and surgery, and 12% is administrative work and educational work, like what I am doing now is 10%, and research work is like 8.3%. So that is the work pressure and the work distribution in orthopedics. And if you ask an orthopedic surgeon, do you think you wish that you work more hours per week? Not even a single orthopedic surgeon telling that they want to work more than what they are working now. So which means they are already overworking. Can you see that? And if at all they want to work little fewer hours per week. So which means the work-life balance is very, very tough in the specialty like orthopedics and surgeon. And I agree with that. And if you take, if you ask this question, several orthopedic surgeons come out with this. I don't have as much time for my personal life as I should have. 75% of orthopedicians are agreeing with that statement. I don't have much time for my personal life. But despite them having a very bad work hours, very bad work scheduling, and very poor work-life balance, if you ask them this question, are you happy with the specialty? Will you change your specialty? They would say, you look into the percentage, they would still agree that they are very happy. 95% of them are very happy with their specialty, and only 8% of orthopedicians were reporting, if given an opportunity, I will change my specialty. So despite a tough work-life balance, I think orthopedics the orthopedicians feel that they are happy, because the definition of happiness is very subjective. So there comes a family and the work-life balance. So in my opinion, I had this philosophy told to me by one of my mentor in Melbourne. So my mentor was telling me, Kathir, there is only 3 F in life, and life would give you the 3 F, but take only 2 F. If you want all 3 F, then life would give you another 4th F, which is a 4-letter word, and it starts with F and it ends with K. Then I asked, what are all the 3 F? Then he said me, the 3 Fs are family, fame, and fortune, and never choose more than 2. If you choose more than 2, then you will end up with a 4th F, which you really don't want, okay? So if you want a family and fame, don't worry about fortune. You will not make any fortune. If you are making fortune and fame, don't think about your family. You are not going to have any work-life balance or greater family life at all. And if you are thinking of fame, family and fortune, don't worry what the society would tell about your ethical principles and things like that. Don't worry about your fame. Just work on your family and fortune. Just 2 out of this 3 F. That is what my philosophy is all about now. So it is at last you, what defines success to you is just about you. You are the person who is defining your success. But what comes during the training in orthopedics and when you are practicing orthopedics is this question: am I talented enough? Am I talented enough to call myself? Am I having a skill set to call myself as an orthopedic surgeon? Guys, remember, any skill, whether you are an orthopedic surgeon, whether you are a physician, whether you are learning any skill, even in order to cook something, okay, when you start learning, you will immediately say, like, just after making one Maggi noodle, a kid would say, oh, I'm pretty good at cooking. I can make everything. So any skill set is having this Dunning-Kruger effect. It just, the moment you learn something new, you will think you are the best in it, right? And then you will start reading more and more and more. The more you read, you will go more into depression and think that, come on, I'm ashamed, I'm embarrassed, I don't know anything about this. I have no clue why my biryani is not tasting the same. The first time biryani is different and the third time biryani is different. I'm not producing a consistent result, and you will feel ashamed, right? So similarly, orthopedicians as well, every single surgical specialty will have this insecure canine, and then they want to improvise their skill. Yes, slowly they will learn up, and then they will achieve another set of confidence. Okay, that is the confidence which comes with with you learning more and more and more over time. Okay, time teaches you a lot. And I'm telling, despite reaching everything, the more you learn, the more you will feel that you are ignorant. And that is what called as a confidence gap. No time you will get back the confidence that you had, like the child's skill. The first time confidence, what you had, you will never get back that confidence, simply because when you had the confidence, you don't know what exactly is in there. So you were thinking that you could do everything. So that gave you a very different kind of confidence. But having known everything, despite having a great skill set, you might not feel the same confidence ever again, I'm telling you. Okay, so that insecurity, can you acquire any skill? Yes, with training, you can acquire a skill set, but you have to, it is your responsibility to build up the confidence that you can do it, and climbing up the ladder of growth is a choice, it's a willful choice that you should be taking. So remember, if you feel that you are not naturally talented for orthopedics, or any other subject for that matter, remember, hard work will always overcome a natural talent when natural talent does not work hard enough. So someone might be a naturally talented person, when some person might be naturally skillful. But I am telling you, if you are having hard work, your hard work will always overcome even the natural talent when the natural talented person are not working hard enough. So it is, the skill set is always about working hard. Think about orthopedics. Think about your surgery all the time. You'll be fine. So create your own ecosystem. As a surgical specialty, you care for the patient, you cure the patient. And as a surgeon, sometimes you have a big responsibility to grow as a team. Okay. So if I'm establishing my system, I should create an ecosystem, and I should create a pyramid in, like if as a surgeon, if I'm operating on the patient, it is not only just about me, right? It is a teamwork. I need an orthopedic assistant. I need a, I need an anesthetist to help me. I need a nurse to help me. I need an anesthetic nurse to help me. I need a techie in my theater. And when the patient is coming out, I need a critical care medicine to assess the patient in the postoperative ward and things. And I need a physician. I need several other specialty to come into the picture. And I need my X-ray technician to handle the radiology. And I need a lab technician to work with the chemicals. And I need, heaps of, it's a big ecosystem that you can establish as a surgeon if you are having the leadership potential. So make sure that you are creating that ecosystem and grow together. And don't think that it as a specialty, it is just about you. Okay. And you will never grow if you think that it is always about you. So try to embrace other culture people and from various domain and try to evolve together. I think the success is not far away. So competition, orthopedics is highly competitive, and it is well saturated. Come on, guys. I'm telling you, if you brand yourself properly, your cup of tea is yours. Don't be insecure. Okay, don't be insecure. And if you brand yourself properly, your cup of tea is yours, and the competition becomes irrelevant. Okay, so what you should be doing, you be passionate about it, learn more about it, develop your skill set, and compete with the world. I think the competition becomes irrelevant, and you become more relevant. So at last, let me tell you, everyone wants success. And what is your definition of success? The definition of, this is not my definition of success. This is Webster Dictionary definition of success. The attainment of wealth, favor, or eminence, where eminence is defined as a position of prominence or superiority. That is Webster definition. If this is what your definition, then chase it. But my definition of success and my definition of happiness is different. And similar, so do you. So whatever is your definition of success, chase it accordingly. And whatever is your definition, I feel orthopedics is one such department which can fit into any of your definition, and you can still be successful. Okay. So this is not a hard and fast rule or definition of success, in my opinion. So scope and career, is there any good scope for orthopedics? And is there any good scope for orthopedics as a career option? If you ask me, I would say, as long as there are mobility, as long as there are mobility in humankind existing, orthopedics is not over. Orthopedics is never over. As long as there are games to play, it is never over. It is not over. So as long as man want to remain mobile and freedom and deformity free and young and youthful, orthopedics will find its own way. So does it have a scope in current medicine practice? Yes. Is it a good career choice? I would say yes. Thank you, guys. Thanks for the opportunity. I leave the podium for any questions for me to answer.